I've been around through the development of an awful lot of vaccines, which are now routine in pediatric practice. And it is true that the timeline for the studies, for licensing studies, can often be many years. The difference is that when you structure a trial to determine the effectiveness of a vaccine, you create two groups, the vaccinated group and the unvaccinated control group. And what you're looking for over time is enough data to show that there's a difference in the incidence of disease between the group receiving the vaccine and the group not receiving the vaccine. And if all the disease occurs in the not vaccinated group, when the populations are otherwise comparable, you get the first signal that the vaccine is effective in preventing disease. Now, in some diseases for which we have vaccines, like meningitis, the incidence of the disease is fairly small, maybe 100 or 200 cases nationwide in the course of a year. In order, in your study group, which is obviously not the entire nation, in your study group, to have enough cases show up in the unvaccinated group, when you compare it to the vaccinated group, it takes a long time with that low incidence of disease. COVID, on the other hand, unfortunately, we have tens of thousands of cases occurring nationwide every single day. There's lots of disease around. And when you study 30,000 people in a vaccine trial, the half that is unvaccinated is at significant risk of getting the disease in a fairly short period of time. So you start to get a signal that compares the incidence of the COVID disease between the unvaccinated control group and the vaccinated group fairly quickly. And so you can get in the space of 2 to 3 months with a disease with a high incidence, the same amount of data and the same amount of effectiveness signal in those couple of months that would ordinarily take you many years, such as with other vaccines. So it's a unique setting because of the incidence of the disease that we are able to get this data so quickly. And that's not a negative, that's a positive for the vaccine development because it enables us to roll out an effective vaccine, to do a study that follows all the rules and cuts no corners, and yet to do it quickly and have data that is highly significant, showing the effectiveness of the vaccine on a very short timeline. That's what you need in a pandemic outbreak.